I am looking carefully at the numbers virtually every day, and I'm saying to myself, I know this new variant is more easily transmitted, and I know that it can actually bypass some of the vaccines that we've all been taking. And I just wonder, how serious is it going to be for people who are most at risk, older people or people with diabetes or others who are exposed to a lot of infection?
Yeah,
And I'm still,
sorry to interrupt.
I'm still really asking everybody, please be super careful over the coming 2 or 3 weeks, because we're not yet at a point where we can look each other in the eyes and say we're through the worst of it. Actually, I think we're just coming into the toughest part, the part when a lot of people are being infected, a lot of health workers actually are suffering, a lot of people in essential services like hospitality or travel are getting infected, and we are going to have to batten down and weather this one in true human spirit. We just don't have any alternative. There's light at the end of the tunnel, but the end of the tunnel is still some weeks, even months away.
Yeah, Dr. Jenny Harries talked of a glimmer of Christmas hope, didn't she, this morning? And it appears from the data that people are less likely to go to hospital, but most of the people who are infected are the younger cohorts. So when do you think we will know about how this impacts older people?
Well, I asked my colleagues in the sort of center of the World Health Organization, the people who analyze the numbers, and they're saying, even though we've got 2 or 3 studies coming through now that suggest that Omicron is not quite as nasty as the other variants of COVID, they're also saying, just be careful, because we just do not yet know how older people are going to be affected. We also don't have data on how people who've not been vaccinated are going to fare. And so please hold on, everybody. Really do everything you can to minimize contacts this Christmas. Just try to avoid having to get up close to a lot of strangers in the pub or something. And let's focus on next year. Let's focus on getting through 2022, getting ahead of the virus, and then having a really good celebration at the end of 2022, rather than feeling that we've got to just do everything possible this year and then getting into trouble. So I'm going to say, please take it carefully. Please treat it with respect.
2021 was all about the vaccine, wasn't it? The development of it, the rollout of the vaccine, and everybody hoped that it would be the game changer. It would stop this in its tracks. Is 2022, I mean, we're already talking about potentially giving people a 4th vaccine now. Is 2022 going to be about the other treatments that might come on stream to really help lessen the effects of COVID?
Well, first of all, we've got some lovely success stories with these vaccines. Wonderful stories of science coming to the rescue of humanity in a way that none of us really anticipated even a year ago. And we've managed to be able to separate now getting sick from actually succumbing and dying. And that's a really brilliant situation to be in. Unfortunately, not everybody is benefiting from this. There's still a real unevenness in vaccine availability around the world. So my wish for 2022 is to get vaccines available for everyone, everywhere. Then we're going to get these treatments. Now, they're still early stages, and I'm looking very carefully at the data. Let's not assume that we're going to be able to treat all the COVID that we're going to have next year. We're going to be able to see some treatments come on stream. Most importantly, the thing that makes the greatest difference is being careful about our contacts. Wearing our masks makes such a difference. I just wanted to be clear with everybody. I take my mask wearing seriously. I encourage you to do so as well. It's a real sign of respect for others if you wear your mask, particularly when you're in shops, when you're in hospitality, or when you're social. And perhaps the most important thing I want to say is, if you aren't yet fully vaccinated and boosted, please do your best to get your booster quickly. Even if you're hovering with uncertainty, I want to say to you, looking you straight in the eye, get yourself vaccinated. It really is worthwhile. And it's also good for others in your family if you know that you are protected and having a much less likelihood of severe illness.
Okay,
Remember,
message coming over loud and clear on
Yes.
that, David. I'm just wondering, final question for you, really.
Yes.
Given the very high levels of transmission with Omicron, is there a chance that the level of immunity that will result from the number of infections could be the variant that turns it from being a pandemic, an epidemic, into endemic?
Yes, Samantha, I really don't like looking ahead and making predictions, but because it's Christmas Eve and because I'm here with you tonight, let me just give it a chance. I actually do hope that this new variant is going to be the variant that spreads widely, that infects quite a lot of people, and that combined with vaccines leads to a much greater immunity among the human population. I'm also hoping that it's the beginning of this virus becoming less virulent. We're not there yet, and it's going to be a bumpy ride, but let's just all hope and let's do our best right now to keep ourselves and our families and our communities as healthy and safe as possible. And who knows, as my colleague Dr. Tedros, who runs the World Health Organization, says, let's beat this virus in 2022. It's a goal that really is worthwhile to achieve.
Yes, here. I think everybody watching will agree with you entirely. Really appreciate you taking the leap into the unknown there for us, and also appreciate your time on Christmas Eve. Dr. David Nabarro, Merry Christmas. Thank you.
Thank you, Samantha. Merry Christmas to all viewers. Thank you.